Let's do it. All right, we are live. And I will pass it over to you, Lashunda.
Alrighty. Good evening, everyone. Thank you so much for joining us this evening. We have a really rich agenda today for tonight's meeting. Blaine, do you want to just start off with a quick roll call, and then we'll introduce our guest presenter for our meeting today?
Yep. So I'll just list names, and then if you hear your name, just say here or present or however you want to make yourself known. Robert Bennett.
Present.
Samantha Davis, I do not see at the moment. Emily Gunston, I do not see at the moment. Ron Hampton.
Here.
Lashunda Hill.
Present.
Corey Knight. I see you, Corey.
I'm here. I'm here.
All right. And Sultan. All right, thanks. I'll pass it back over to you, Lashunda.
Great, thank you. I want to just start by thanking all of the commissioners who have, up until this point, we've had some really rich conversations about violence and incidences of violence here in the district and how the district has responded. And one of the areas that this committee wanted to delve more deeply into is specifically domestic violence, gendered violence, sexual violence, and how the district has responded, how the police have responded to those types of incidences of violence. And so we are really grateful today to be joined by Michelle Garcia, who's director of the Office of Victim Services and Justice Grants, who is going to guide us through a presentation and then what I hope will be a robust discussion about her work and her expertise in the forms of violence that specifically disproportionately impact women and girls nationally. She's worked on the national, state, and local level here in DC, and I think that we will really benefit from her multiple decades of experience. One of the things that I'm hoping that we'll have after her formal presentation is a discussion about, what are some of the initiatives from her perspective that have been working in response to these instances of violence, where there's an opportunity to expand those programs, to scale them up. We've talked a lot about that in terms of violence interrupters and other programs, but also where there are some remaining needs, where there are some gaps that this particular committee can delve even deeper into as we develop our recommendations and specific, policy levers that we can pull to improve the delivery of those services, specifically to those populations that have been historically underserved here in the district. And so with that, I will hand it over to you, Director Garcia, for your presentation. And I know Blaine has set it up where you can share your screen. And thank you so much for joining us.
Thank you so much. It's an honor to be here. And let me share this. Can you all see that?
Yeah.
Okay, great. So first, thank you for the opportunity to talk with you this evening. And I particularly want to thank Jennifer for the insight and guidance she provided. As you know, my name is Michelle Garcia. I'm the director of OVSJG, the Office of Victim Services and Justice Grants. I'm also currently serving as the interim director of the Office of Human Rights. I've been with the district for almost 5 years now. And prior to that, most of my career has actually been in the nonprofit sector, working on the issues of stalking, sexual assault, domestic violence, and dating violence. Immediately before joining the district, I spent 10 years at the National Center for Victims of Crime, leading the National Stalking Resource Center. So the discussion around gendered and gender-based violence is very near and dear to my heart and what I've spent most of my life working on. I put together a presentation with just some initial information on data and efforts to start this conversation. In talking with Jennifer, I'd also included some information about our hospital-based violence intervention program, and actually have that early in the slides. And I think I may just skip over that and we can come back to it later in the conversation if there's specific questions. Because we're going to be talking about the topics of domestic violence, sexual assault, stalking, I do want to acknowledge based on the statistics that I'll be talking about more, the likelihood is that there are people on this call and who may be watching who themselves are victims and survivors of any or many of these forms of violence. And so I just want to encourage people to do what they need to do to take care of themselves throughout our conversation. Just as a little bit of a reference point for those who may not be as familiar with the Office of Victim Services and Justice grants, our mission is to develop, fund, and coordinate programs that improve public safety, enhance the administration of justice, and create systems of care for crime victims, youth, and their families in the district. A significant part of our work is as a grant-making organization. So we provide funding to community-based organizations and other district agencies that provide services to victims of crime, all types of crime, to justice-involved individuals, so incarcerated and returning citizens, both youth and adults, and to youth who have experienced or are at risk for juvenile delinquency or truancy, and recognizing that those are not mutually exclusive populations. Our programs are multiple. So OVSJG passes through the funding to the DC Bar Foundation for the Access to Justice program, which provides legal services to low-income and no-income residents of the district. Our Victim Services program, which provides a variety of services to victims, again, of all types of crime in the district. The district's address confidentiality program, which is about to launch, which is a safety tool for victims and survivors of the types of violence we're going to be talking about, to keep their residential addresses confidential so that someone who may be trying to harm them has a more challenging time locating them. Our Justice Grants program, which is the umbrella under which our reentry and juvenile delinquency work falls. Our Truancy Reduction program, most notably our Show Up Stand Out program, which is a truancy reduction program that's based in elementary and middle schools, as well as a high school truancy reduction program. The district's private security camera incentive program. A new program that is rolling out this year called the Trauma Response and Community Engagement Program, and I'll talk more about that during this presentation. And we're also responsible for coordinating the district's Domestic Violence Fatality Review Board, as well as the Juvenile Justice Advisory Group. So we touch, often I think about it as the spectrum of the criminal justice system, both looking at the experiences of victim survivors as well as those who are justice involved, and recognizing again that those are not mutually exclusive individuals. One of my priorities since I've been in this role has really been working to break down the false victim perpetrator dichotomy. And again, I'll talk more about that throughout my presentation. So I'll skip over the hospital piece, and I'm happy to come back to that as we have our discussion later, but focusing in on really the gendered and gender-based violence pieces. I'll start by saying that this is always really challenging when we start from looking at what does the data tell us, because when we talk about the crimes of domestic violence, sexual assault, stalking, we know that these are vastly underreported. And so when we start to look at the data, we can look at that which gets reported to law enforcement, that data in which individuals are interacting with our court system, seeking civil remedies. But there's also at least two that I'm going to talk about, fairly robust sources of data that are based on victims and survivors sharing their own experiences through large national surveys. The first one of those is the National Crime Victimization Survey, and this is an annual survey conducted by the U.S. Department of Justice Bureau of Justice Statistics that has been happening for close to 50 years at this point. That is a random household survey of individuals 12 and over asking about their experiences with crime victimization. And so when we look at the data from the most recent report that was released by BJS, which was their 2019 data, what they found was that there were about 5.5 million total violent incidents involving victims aged 12 or older. And when they describe violent incidents, that includes rape or sexual assault, robbery, aggravated assault, simple assault, including threatened or attempted or complete occurrences of those crimes. But they also are able to look at that data and how it matches up to what's called the Uniform Crime Report data that law enforcement agencies across the country submit to the FBI. And what they find, both based on victims' own self-reports as well as that UCR data, is that less than half of violent victimizations get reported to police. That's probably not surprising to anyone on this call. When we look at gendered violence, so again, domestic violence, sexual assault, stalking, in 2010, the Centers for Disease Control and Prevention launched an annual survey called the NISVIS, the National Intimate Partner and Sexual Violence Survey, that specifically looks at incidences of intimate partner violence, sexual violence, and stalking in the country. Again, it is a randomized household survey, and the data that has been coming out of the NISVIS surveys since 2010 has been fairly consistent and reflective of data that we have seen in decades prior to that. And first and foremost, we know that intimate partner violence is widespread, that about 1 in 4 women and 1 in 9 men were victims of contact sexual violence, physical violence, and or stalking by an intimate partner. And I will say that it is, in my experience, rarely only one of those that somebody experiences. There is more often than not this intersection of those. So as someone who spent, a decade working specifically on stalking, I will tell you it is a common tactic amongst DV abusers and batterers. And so when you're talking or working with someone who's a victim survivor of domestic violence, there's an incredible likelihood that they have also experienced stalking as well as sexual violence. So often the lived experiences of victims is not just it's one or the other, it is actually all of these. When we look at sexual violence, about 1 in 3 women and nearly 1 in 6 men were victims of contact sexual violence at some point in their life. And contact sexual violence is this broad category that the CDC uses to include instances of rape, being made to penetrate someone, sexual coercion, and or unwanted sexual contact. So then we look at, all right, we have a sense of what the national data is, but what do we know about DC? Well, the NISVIS in 2015, I believe, actually released some statewide data. And so looking at the national data and being able to isolate some of the responses from specific states, they did release some statewide reports looking at lifetime. So one of the important things to acknowledge is these are of individuals who reside in DC, what their lifetime experiences were with any of these types of violence. So it could have been someone who was sexually abused as a child in their home state of Michigan, but now resides in DC. So it doesn't necessarily mean that that incident occurred in the district or even occurred recently. What they found was 39% of adult women that were residing in DC experienced physical assault, sexual assault, or stalking again in their lifetime. And that 35% reported specifically physical assault. So pretty startling numbers. Another resource we could look at for local numbers is the National Network to End Domestic Violence does what is called an annual domestic violence count census. I believe they have been doing it for 15 years now, where they survey domestic violence providers across the country over a 24-hour period, assessing how many victims were served by those providers, and it's done on a statewide level. So the most recent census for which data is available from NNEDV is the 2019 census. And what they found was from the district providers that participated in the census, 569 victims of intimate partner violence were served in one day by our DV providers. That includes 533 adult and child victims who received some form of shelter or housing. So that could be emergency shelter, it could be transitional housing. And then another 36 adult and child victims who received non-residential assistance. That includes counseling, legal advocacy, children's support groups, medical forensic care, financial assistance, and other types of services. Then we could look also at some of our system data. So one of the fairly stable numbers that we hear in the district are about the number of domestic violence calls that are received annually by the Office of Unified Communications or by Mpd. And that number usually is right around $35,000 calls. When I first joined the district, I think the number was 33,000. It's gone up, it's gone down. But there's a really critical piece to understand about how we define domestic violence in the district and what these calls mean. These calls are not just intimate partner violence, what often people think about when they hear the term domestic violence. In the district, domestic violence is an umbrella term that includes any act of interpersonal violence, intimate partner violence, and intra-family violence. So these calls would include any family, household, or intimate partner violence. So for instance, it could be an incident of a report of violence between siblings in a household, or between a parent and a child, or even between roommates. So it's a broad category, and it doesn't get broken out by each of those categories. They just all fall under that label of domestic violence. When we look at the Mpd statistics around sexual violence, what we find is, we have data as of 2018, 2019, and also as up to December 4th of this year, 277, 188, 155. Again, the vast majority of sexual assaults don't get reported to law enforcement for a variety of reasons. We can look to a couple other places to try and get some more accurate numbers. So we can look at how many sexual assault forensic examinations are conducted in the course of a year. That number has fluctuated over time. I believe last year the number was around 250. I was trying to confirm that number before we got on the call, but still need to get that information confirmed. But again, one of the things I'll note around that is when we think about medical forensic exams, the guidelines for the performance of those are generally that they're performed within 72 to 96 hours of a sexual assault. And so beyond that time, there's a recommendation not to have those performed, just because of the trade-off between the viability of any evidence that may be collected versus the intrusiveness of that medical forensic exam. And we know that it is not uncommon for sexual assault victims to delay reporting by hours, days, weeks, months, if not years. So it contributes to our challenge to have, a really clear understanding. We can also look at our courts. So when we look at the court data from the district court around their domestic violence division, so the data that they have is around new filings. So these are petitions for civil protection orders, misdemeanors. So these would be anything related to a violation of a protection order, or criminal contempt cases, which is a new category for the court, specifically around the retrieval or the seizure of firearms. So when we look at those filings for protection orders for 2019, it was over 5,500 cases. But again, it is anything that is under that umbrella of intrafamily offense, which is those family, household, and intimate partner violence cases. So this could again include a child-parent relationship. It can include what we've seen are common partners. So the former partner of somebody filing a protection order against the new partner of the partner they have in common. We've even seen landlord-tenant cases getting filed in the domestic violence division because of that really broad umbrella category of what falls under those definitions of intrafamily or interpersonal. So you can see that we have a sense, both from when we look at the data, also from what we know about the national data, from what we see in terms of the data that we collect from providers. I will say in the decades now that I have been doing this work, the numbers have not fluctuated dramatically. We have seen in terms of prevalence, we have gotten better data. We've been able to drill down and understand more about dynamics. We have seen fluctuations in terms of reporting. One of the things that I will always say is that increased reporting often alarms people. But from my perspective, we know the prevalence rates have stayed pretty steady decade to decade. And what increased reporting often can indicate is not necessarily an increase in the incidents or the crimes or the violence itself, but people's ability or willingness or responsiveness of those systems that is empowering people to reach out and make those reports. So one of the things, I did a fair amount of work around sexual assault on campus. And, you know, as I got to that age where I had friends who were taking their kids on college campus tours, one of the things I would always say to them is when you're doing those tours, ask about their reporting rates on sexual violence on campus. And for the campus that says they have none, do not send your child to that campus because the incidents are going to be pretty similar across. And the ones that have the higher reporting rates are the ones who have created an environment where victims and survivors feel like they can come forward and get assistance. So those are some of the pieces of data that we have. And then I want to just talk briefly about some of the sort of broadly approaches to addressing both these types of violence as well as other violence. And I'll start by saying that I actually came to this field as a prevention educator. And so the framework that I bring to this work is that public health approach to prevention. So primary prevention is that takes place prior to an incident occurring in order to try and prevent it, absolutely prevent it from happening. Secondary prevention is that immediate response after the violence has occurred to deal with the short-term consequences of those violence. And then the tertiary piece is the long-term response after violence has occurred to deal with the long-term consequences of those violence. OVSJG and the work that we fund sits almost entirely in that secondary and tertiary levels, that we are funding community organizations, a majority to respond to the needs of victims after they have experienced victimization, whether that's the immediate aftermath or the long-term aftermath of that. We do provide some funding to organizations who are also doing prevention education as part of that broader intervention and response that they're doing. So it may be funding components of prevention programming that's happening in schools or with community organizations. I'll talk about one specific provider that we do support and the work that they're doing. But really most of our work falls in that tertiary and secondary area. And I'll talk about where some of the other primary prevention work is happening in the district. So when we think about gender-based violence, the recommendations really in terms of addressing it tend to be one that primary prevention efforts start early and continue through adolescence and adulthood. So we can start talking about concepts like healthy relationships, safe touch and unsafe touch, consent, early with children and youth in age appropriate ways, and then scale up and continue those conversations throughout adolescence and into adulthood. So starting those conversations early and having them be routine and continuous. That for truly to be successful, what we want to see is this partnership between our public health partners, along with education, justice, social services to implement the prevention efforts. I will say, you know, a really critical piece of doing any prevention work is to have those response pieces in place, because once you start doing that primary prevention work, say, for instance, you were going into schools and you were talking about dating violence, domestic violence, sexual abuse, sexual assault, you will have individuals disclosing to you. I spent years working in elementary, middle school, high schools, and colleges. And I cannot recall ever having done a presentation in a school without having at least one student come to disclose to me after one of those presentations. And so it is really critical that we have those responses in place when we're doing that level of primary prevention, and in place to respond immediately, and have those systems well-informed and well-equipped to respond to those disclosures. And then also that we're using data to monitor both the extent of the problem as well the impact of those prevention efforts and the services. A couple pieces I'll highlight here in the district. So when we look at the prevention programming specifically around this type of gender-based violence. Most of that work is being coordinated out of DC Health in their violence prevention program. So they're actually the recipient of the Federal Violence Against Women Act rape prevention education dollars. They support programs for schools around dating violence, sexual assault, including Speak Up, Be Safe, Dating Smarts, and Relationship Plus. I mentioned we fund some of this, but there are lots of CBOs or community-based organizations that are providing prevention programming on all of these issues, as well as human trafficking and the intersections of all of these. One of the ones that I'll mention is the Healthy Masculinity Action Project. So this is actually a project that is a coordinated effort of multiple organizations throughout the country, but it is being led by an organization based here in the district called Men Can Stop Rape. And it's an initiative designed to raise the visibility of healthy masculinity and build a new generation of male leaders across the country who model nonviolent, emotionally healthy masculinity and serve as positive change makers. When we look at domestic violence, sexual assault, stalking, it is disproportionately committed against women and girls by men and boys. And so there is a strong evidence behind promoting healthy masculinity as a way to try and prevent some of those incidences of violence from occurring. And then the last piece I'll mention is the Office of the State Superintendent. So in 2018, Council passed the School Safety Omnibus Amendment Act, which requires schools to prevent and address both student sexual abuse by school staff, as well as student-on-student acts of sexual harassment, sexual assault, and dating violence. And so OSSI was tasked with doing a couple different things, including drafting a model policy for schools to respond, identifying training components around the prevention activities, and also recommending different training or curricula. And I believe those activities were completed earlier this year and are available on OSSI's website. So those are some of the pieces that are happening. Really the last thing that I want to talk about, unless we go back to the hospital-based piece, is that, when I think about not just gender-based violence, but all the different types of violence that we see and that our grantees are addressing, there's a lot of different contributing factors. And I imagine you have had lots of robust discussions about all the elements that contribute to various forms of violence in the district. For me, the one that I think hasn't historically gotten as much attention, but I think is changing and has the most promise to have an impact long-term, is addressing trauma. And when I talk about trauma, there's a lot of different ways we can define it. I think the Substance Abuse and Mental Health Services Administration at the Department of Human Services has a really good, succinct definition. And that is that individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effect on the individual's functional, mental, physical, social, emotional, or spiritual well-being. We have extremely high rates of trauma in the district, both individual, family, community, generational, and historical trauma. And I will say, based on my experience and the discussions that I have had with our grantees who touch people in lots of different communities and lots of different populations, that is the thread across all the populations our grantees touch. Obviously, when you're talking about victims of crime, trauma is an understandable reaction. But when we look at our justice-involved individual populations, I will say if you started doing that assessment and looking at an individual's history, the majority of them will have their own victimization histories, and almost all of them will have a trauma history. And if they've been incarcerated, if somehow they did not have a trauma history prior to incarceration, they will absolutely have a trauma history post-incarceration. And so from my perspective, I think one of the things we can do that can have the most impact on reducing violence is to effectively recognize and respond to trauma and create systems and responses that are trauma informed. And that is at all levels. That is, highlighting the work that is happening in schools all across the district, that are shifting our framework from students who are quote unquote acting out in the classroom from a response of what is wrong with you, child, to what has happened to you, child. That is training individuals to be able to respond to someone who is hypervigilant because of their trauma history. And if you accidentally touch them, or if you engage in what seems like a minor conflict to you, can escalate really quickly because of that trauma response. So for me, this is one of the areas that I think doesn't have short-term impact necessarily, but can have long-term impact. And so as an agency, we have been committed in the time that I've been with the agency to really enhancing the ability of our grantees to effectively recognize and respond to trauma, and also trying to enhance the resources in communities to effectively recognize and respond to trauma. And so I mentioned one of our programs at the beginning is the Trauma Response and Community Engagement Program. And this is a place-based response on a neighborhood level around working with the community so that it is a community-led effort to identify the needs of that community, engage the community leaders to guide what those services should look like, enhancing the capacity of those leaders who are already doing that work to enhance their ability to respond to trauma, and then providing those trauma-specific support, mental health services for individuals and families to give them the tools to help them heal and build their resilience. And I think the long-term outcome of this is we will see a reduction in violence, but again, it's not something that'll happen overnight, given both the realities of people's trauma experiences, as well as the fact that you still have individuals who are living in environments where there is ongoing violence and ongoing toxic stress. But this is where I see some of our great promise in all of this type of violence reduction. The last piece is I have several resources for anyone who's interested in more information about any of the surveys or the reports that I talked about. I'm happy to send this over to you all. I can also just cut and paste the resources in the chat so that you have them. So I will pause there to see if either you have any questions or if you would like me to go back and talk about the hospital-based violence intervention program if you have specific questions about that.
Thank you so much, Director Garcia, for your presentation. There's so much information here. For the commissioners, what I like to do is to just start to see if there are any specific questions. And then for the remainder of our time, I do think it would be great to hear about some of the hospital-based work that you're doing, but I just want to pause here to see if there are some initial questions. I have a couple if no one wants to start. But
I do, but
okay.
I mean, go for it.
Sure. So one of my questions was just specifically around what you mentioned about hypervigilance and trauma responses. And I think that that's particularly relevant to the work of this commission when police respond to these instances, and the reaction from, and you were talking about sort of the false dichotomy between victim and perpetrator, can really be a trauma response. It's that hypervigilance. Can you talk a little bit about that and what from your experience and expertise, what alternatives to a police response to those instances can look like in terms of effectively being able to navigate a lot of those complicated situations?
Yeah, and so let me start by saying I'm not a clinician by training. I've just worked in this area for some time, and I think there are people who can speak to this way better than I can, and I'm happy to point you to those folks. But I'm a trauma survivor myself. I've worked with trauma survivors for most of my career, and when we look at trauma and how people navigate that. You know, we look at an event that someone has experienced. We look at how we look at the event, we look at their experience of that event, and then we also look at what are the effects of that. And when we look at the effects, they are as diverse as people are diverse, and they are impacted by, you know, someone's previous experiences of trauma, the support system they have around them, the resources that they're able to access. In some cases, you know, people's responses are internalized. So you see there are people who shut down, and in some cases they're externalized, and there's people that have difficulty regulating their behavior or controlling their expressions of emotions. That hypervigilance piece is a really common one, right? Somebody who is always on and attuned and attentive to what is happening. It's that coiled spring, right? And you touch it and it just explodes. So I think really a most basic starting point is enhancing all of our abilities to effectively recognize and respond to trauma, and know that in some of these cases that I'm sure you have talked about, that person is responding in a normal way to something abnormal that they have previously experienced. And that in some ways they are not even entirely in control of that reaction, because they have not been given the tools or the resources to process it or to self-regulate it. And so it is about, again, both recognizing it and having people responding to calls, situations, reports that have that experience, that have that training, and that have an ability to really de-escalate a situation rather than contributing to that situation escalating.
And just as a follow-up to that question, you also mentioned the need for, you know, cross-sector, cross-agency coordination and collaboration. So where in your experience in DC government and working with CBOs, where would that type of coordination or programming, where would you think that would live? Where best should that live?
So some of it I know already exists. So the Department of Behavioral Health's community response team is doing some of that work. And I don't know how much of an opportunity you've all had to look at the work that they're doing with that, but that team took elements, various Department of Behavioral Health elements that existed, our access helpline, the community response team. The community response team also was doing work specifically with Mpd. I believe there was a project that rolled out about 2 years ago that was about having clinicians actually responding to individuals who were experiencing mental health and or substance abuse incidents. And so rather than having that primary law enforcement response, it was about having that clinical response to be able to try and connect them with the services that they need. So some of those efforts are already there, and perhaps can be expanded or scaled up on. I also know that there is training that is, and again, someone else can probably speak way better to this than I can, with certain officers within Mpd who've been trained around some level of that crisis intervention. There's a term, crisis response officers, or something to that effect. But again, perhaps there's an opportunity to scale that up.
Other questions? I can keep going, but I want to make sure that we also have others if you have questions.
I would just ask, Michelle, you could, let us know, like, after this, like, maybe connect with Jennifer about, like, who some of those clinicians are who are doing that work. Because I think it'd be great to speak with them about, like, what else they need, how we could impact that, what some of their challenges are. Because as you know, like, we're tasked with coming up with a recommendation, and I would assume a lot of it is really expanding that kind of work. So that'd be really, really helpful to speak with.
Yeah, Anthony Hall is the coordinator for the community response team at DBH, and I'd be happy to provide his contact information to Jennifer or to Blaine or whomever.
I have a question. So 2 quick.
And Bob.
I'll yield to Christy, then I'll come back.
So one question, so two quick questions and one to follow up on Sultan's question. You mentioned that the definition of domestic violence in the district is broader than some people would think. It goes beyond intimate partner violence. You may not know the answer to this question, but do you know whether the mandatory arrest requirements that go along with domestic incidents of domestic violence apply to all those kinds of domestic violence, not just the intimate partner violence, so also to the familial violence and any household violence? I don't know if you know.
I would need to confirm it.
Okay.
My assumption would be yes, because they would all fall under that intrafamily offense, right? And the mandatory arrest piece is for any violation under that intrafamily offense. So my assumption would be yes, but I would want to confirm that. And I think I saw Ron shaking his head.
Yeah, and that is my understanding as well, but I was hoping to get confirmation, but it sounds like that's it. But we can definitely confirm that. The second is, are there any limitations regarding who you can provide grants to, or who your agencies can serve? For example, individuals who are undocumented or anything else, who's not eligible for your services. Anyone in the district can get services?
Absolutely. So it's the services that we fund for crime victims are either for residents of the district who have been victims or survivors of crime, or for someone who has experienced a crime in the district. So you may be a resident in Maryland and you were in the district because you work here and you experienced a crime. You are absolutely eligible for the services. And the services that we fund is so that those services are available at no cost to victims.
Okay, great. So then my two other questions, I realize there's two, not one. One is, so Sultan asked about clinicians whom we might be able to talk to find out what they need. I'm wondering whether I mean, in terms of recognizing, I think the way you put it, it's in my notes somewhere, effectively recognizing and responding to trauma and thinking about that as the way that we reduce violence. Do you have recommendations about what we as a commission, how we could facilitate that through our recommendations? What needs to be mandated? What needs to be asked for? What needs to be suggested in order for the district as a whole to provide a more effective recognition and response to trauma?
And I think that's a great question. I think there's a lot of work that is already being done. And so, I'll point to the work around the school-based mental health work that's happening out of the Department of Behavioral Health, and really equipping schools with more clinicians to be able to work with students and work with families. I'll point to the family success centers that have been rolled out of the Department of Child and Family Services that are again looking at meeting the needs of families in the communities in which they live. There are a lot of schools who had also been doing that work independently, right? So the schools and the LEAs in the district have a great amount of independence. And so many schools have been working with nonprofit organizations, including ones like Turnaround for Children, that have been working to enhance the capacity of teachers and faculty in those schools to be able to effectively recognize and respond to trauma. So I think there's a lot already happening in different sectors by different entities. I couldn't say what else should be mandated, but what I can say is, there are other jurisdictions who have made addressing trauma a cross-sector priority. So I'll point to Philadelphia. Philadelphia back in the mid-2000s committed to being a trauma-informed city, and did and has continued to do a significant amount of work around both looking at their systems and their systems responses through a trauma-informed lens, which is at its most fundamental level, is what we're doing helping or harming people, and also looking at some specific areas in which they believe they could have the greatest impact in addressing trauma, and that included schools, and I believe there was also a law enforcement component to that as well. There are states that have actually taken on trauma as a priority. Oregon is one of the ones that comes to mind. And again, really looking at doing that in institutionalized way throughout all branches of government, and the benefit of that, right? From yes, obviously the sectors we may think about, like policing, like schools, but also on every level, from organizations like ours, or even thinking about the security guard who sits at the front desk of a building that someone walks through, back when we would walk through buildings, but that somebody who is hyper vigilant, and what it might mean when you have to touch that person to pat that down, and when they have a response, and how do you respond to them, right? So like for me, it's how do we make that inherent in everything that we do? How do we bring that trauma lens in everything that we do? And I think there's some places we could look at across the country that have done that, or that have committed to trying to do that.
Thank you so much. It's very helpful.
Thank you very much, Ms. Garcia, for your presentation. My question is relating to the truancy reduction program and its relationship to domestic violence and trauma, and then who's the first responder to those situations? Is it the police, or is it clinicians, or is the where's the first responder to help to assist the relationship? I'm trying to figure this question out. The truancy reduction program, truancy that occurred in the schools, I'm guessing, based on my work in schools, is that the truancy has, in some instance, a relationship to what occurs inside the home.
Yes.
Or in the neighborhood.
I think I know what you're asking. I'll try, and let me know if my answer gets at what you were asking.
Okay, thank you.
So the truancy reduction program that's coordinated out of our office, Shop Stand Out, its primary focus is on elementary students and also to some degree middle school students. And it's really based on the notion that at that age, when you have students who are accruing unexcused absences, it is not because of a choice that a third grader is making to not go to school. It is because of the barriers that the family is experiencing and or that student is experiencing in order to be able to get to school every day on time. When we look at the data that we have from families that participate in our program, and our truancy reduction efforts are voluntary services that are available to students and families prior to them accruing the absences, where they have to be referred to either Child and Family Services or to the courts. So when students accrue 5 unexcused absences, a referral is made by the school to one of the community-based organizations that provide those services. And the service provider reaches out to that family to talk about the supports, the services they have available, how they can assist the family with identifying and addressing any of the barriers that are impacting that student being able to get to school. When we look at the reasons that contribute to students not being able to get to school on time amongst the families that we work with, or that our CBOs work with, there is a wide range. The most common is actually homelessness or housing instability. We see that in about 40% of the families that we work with. And then safety is often, probably I think safety is one of the next highest ones, and that can include safe passage to and from school, not feeling safe being able to get to from school. It can also include things that are happening in the home that have an impact. And so that could include instances of domestic violence. For us, and where we fit in that is that, if our grantee, our community-based organization that we fund, is engaging with that family, one of the things they will try to do is safely assess if that is something that family is experiencing, that parent is experiencing, and then try and connect them with the appropriate resources in order to explore the options that they have available to them. And so that may mean connecting them with one of the domestic violence providers in the district, who can talk to them about their options around getting a civil protection order, around emergency housing, around, relocation, all those pieces that are available to them. So through our Truancy program, it's really about that service assessment, but then it's ultimately up to the victim to make that determination about what they choose, what response they choose to engage in, or what service they choose to engage in. Is that what you were asking?
Yes, and does law enforcement, when does law enforcement, if any, become involved?
So I'll say generally with domestic violence, separate from truancy, law enforcement tends to be involved in one of two ways. I've never really thought about it this way, but either because the victim themselves calls law enforcement, or perhaps the victim's child calls law enforcement, so someone else in that household, or somebody external from the household is calling law enforcement, perhaps because they're witnessing something. So for instance, someone sees a domestic violence incident happening on the street or in a car in a parking lot, and they call law enforcement. There has actually been a startling number of instances since the pandemic where people have witnessed domestic violence incidents occurring in meetings or during school sessions when they're on Zoom. And so then you have somebody else, whether that's a teacher or a colleague or coworker, who are then contacting law enforcement. In some cases, it's the victim themselves. In some cases, it's somebody else.
Commissioner Davis, I believe you have a question.
Thank you. Hi, everyone. I missed your presentation. I'm looking forward to seeing it, the recording. But I did just hear the question around truancy, so this might have been addressed. But I know in some of the work we've been doing, one of the areas we are looking at, like and we as an organization I work with are looking at deprioritizing law enforcement and what specific offenses they're involved in. And one of them is truancy. And so I'm curious on like how your program and the truancy reduction work that you do as it aligns to trauma survivors, how it's connected, if at all, to like MPD engaging in truancy efforts. I think the stat that we saw was in the school year 2019 or school year 2018, MPD picked up youth for truancy over 1,500 times. And so trying to figure out, and so they were the first responders like for that truant young person. So trying to figure out what the difference is or if it's one of the same.
Yeah, so our response has no interaction with MPD around truancy. So what we're really focused on is working with the family to identify whatever barriers they're facing to be able to get their students to school every day on time and working to mitigate those barriers. At no point are our CBOs engaging with law enforcement around this. So we have no connection to that. I don't know what the truancy numbers are by MPD, but I'd be also really curious to see the age breakdown of those because our truancy reduction programs, at least historically, we've been focusing on the elementary and middle school level, mostly elementary. We just completed a 3-year pilot program on high school, which I would suspect are more of those MPD pickups, at least that age group. I don't know, because honestly, it's not an area that we interface with MPD on.
Thank you.
Other questions from commissioners?
Yeah, I had a question.
Oh, go ahead.
I wanted to ask a question about the hospital-based program. We had Dr. Richardson on that gave a presentation and talked about his involvement, some of the studies around it, because he's doing some studies himself while he's doing it. Mm-hmm. And so I was wondering what you think of the ones that we've had here in the district or are operating here in the district.
Yeah, I'm happy to talk about it a little bit more. And if it's helpful, I can just put up a slide that just gives a little bit of an overview of the hospital program, if that would be helpful. Okay, I see a thumbs up, so I'm going to do that. So since you've had Dr. Richardson, who is just amazing, and the work that he does, it sounds like you have a pretty good overview of what the hospital-based violence intervention program model is. And that's about being able to engage with individuals who've experienced life-threatening intentional trauma in the hospital, in those moments in which perhaps there is a teachable moment, to be able to connect them with services and resources to help them and their families heal, but also to attempt to reduce further victimization or re-victimization and retaliatory violence. In the district, I will say that I think our programs and processes evolved a little bit different than they have in some other places. And so for OVSJG, this is actually a program that had been developing back starting in, I believe it was 2014. It was before I joined the agency, and that soft launched in 2015. And it actually came out of the domestic violence and sexual assault providers who were doing medical forensic and advocacy responses in the district for victims of sexual assault and domestic violence, and looking at could they extend that same model of response to victims of life-threatening intentional trauma. And so the first site that we had been working with was MedStar Washington Hospital Center, and a partnership of community-based organizations who really mostly worked in that DV sexual assault and trauma realms. And so that OVSJG had been working on that already at the same time that the NEAR Act was introduced, which looked at establishing the hospital-based violence intervention program out of DC Health. And because of conversations that we then had alerting to folks we were already working on this, the legislation was changed to have that be a OVSJG DC Health collaborative effort. As we launched that initial program at Washington MedStar Hospital, we learned a lot about the program, and also worked a lot and got some technical assistance from some of the national technical assistance providers around these programs, including the Health Alliance, I believe it's called the Health Alliance Network. And so it looks a little bit different today than it did back in 2015, and really reflects probably the model that Dr. Richardson talked about, which is really this pairing of intervention specialists, or credible messengers, as we sometimes call them in the district, along with social workers and clinicians and other social service staff who could provide the services and connect individuals and their families with additional services. MedStar Washington Hospital Center continues to have a really strong program. And I don't know if folks have an opportunity. I shared with Jennifer links to 2 videos that highlighted some of those intervention specialists or credible messengers at Washington MedStar Hospital. I think it's those are both really powerful videos to watch and get a sense of the work that they're doing and the individuals doing that work. Howard University Hospital also has a program, as does George Washington University Hospital. Those are our 3 Trauma 1 hospitals in the district. UMD Prince George's Hospital Center, there's also a program that we support there. And while it's based in Maryland, and Dr. Richardson may have talked about this, that about 40% of the trauma patients that they see are actually district residents who are transported there. And then we also have a program at University Medical Center. And while University Medical Center is not a trauma center, and so that individuals who have experienced life-threatening intentional trauma would largely never be transported there. You might have someone who walks through the door and then gets transported to another trauma site or trauma provider. You do have individuals and families going there for aftercare. And so wanting to ensure that those same connections to supports and services are available out of that site. I will also say that as part of the hospital-based program, the providers have been meeting monthly and since the inception of the program. And once the Office of Neighborhood Safety and Engagement's Violence Interruption Program was implemented, as well as OAG's Cure the Streets, we had invited both of those entities to start participating in our monthly meetings, which they have been for over the past year. And included in this past fiscal year, we've now implemented a case review process where we are actively working through cases with all of those providers. So really trying to coordinate the hospital-based activities and efforts with the other violence interruption efforts in the district, because we know we're seeing the same people. In terms of how's it going, this chart shows since we started collecting these specific data points in 2017, the number of individuals who were engaged. And so by engaged, we mean that intervention specialist or that credible messenger was able to make contact with that victim and to explain the services are available. And that's the red line, which is engaged. And then the gray line is accepted services, which means that that person then said, yes, I would like to have these services. So it's not surprising that the number of individuals who are engaged is going to be higher than those that have accepted services. The numbers have fluctuated over time, I will say, in a large part due to just staffing at the hospitals. That there has been turnover in these programs. There has been changes in leadership at some of the hospitals with varying levels of support or priority for the programs. We continue to work with the hospitals to provide them with the technical assistance to really strengthen these programs. I will say there has been a definite impact because of COVID. So for several of these programs, the intervention specialists or the credible messengers are not actually employees of the hospital. They're employees of community-based organizations. And so because of the COVID restrictions, they're not actually able to meet somebody bedside to do that engagement. And so it's happening via phone when it is happening. And so the acceptance level for services has declined dramatically, because I think that face-to-face contact, that in-person contact is a really critical component contributing to the success of these types of programs. And so we have seen a decline in service acceptance since we moved to the pandemic response. And hopefully someday when we come out at the end of this, we'll be able to see those numbers go back up.
Commissioner Hill?
Yes. You have a question?
Yes. This is a very, excellent program, and hopefully it would get the type of, funding that it needs. My question is, I serve on the board of the not-for-profit hospital, United Medical Center, and our service area, our catchment service area, is principally wards 7 and 8. And do you have any data with respect to how residents in those communities are served? Because this program is not at United Medical Center.
It actually is at United Medical Center. So we do actually have services that are happening out of UMC. They just look different than the other programs because UMC is not a level 1 trauma center. So someone who's experienced a gunshot, a stabbing, an intentional blunt force trauma, so a life-threatening intentional trauma, would typically not be transported to UMC. They would get transported to Howard GW or MedStar, or in some cases over to Prince George's, UMD Prince George's Hospital. But we do actually have a service provider that sits in UMC to provide services and do follow-up. And the grantee organization for UMC is Far Southeast Family Strengthening Collaborative, where they also partner with some additional community providers.
I'm really glad to hear that. Thank you. I'll bring it up at our board meeting on Wednesday. Thank you.
I have a question. One last question. I don't know, Ms. Garcia, if you're aware, on the West Coast, when they started doing this on the West Coast, they created an organization called Alliance of Safety and Justice, and they've been able to bring the engaged together with the service, because one of the things that they've been able to do is to organize the victims into survivors, and they have had a phenomenal impact on some legislation out there as it relates to some of the money that they're able to tap into. They've also been having, up until COVID, they were also having these yearly conferences where they were coming together talking about and developing strategic strategies whereby they could do some of the things that they needed to do to not only enhance the services and make them more effective, but their lobbying effort as it related to legislative issues. But the impact of what they were doing brought that line together of the engaged and the services really almost into being the same line. I was wondering if you were aware of the Alliance for Safety and Justice.
Yeah, so I'm aware of the Alliance for Safety and Justice, and then there's also the Health Alliance for Violence Intervention. So
right.
and they may have originally been the same organization or perhaps separated. I'm not entirely sure. The Health Alliance for Violence Intervention is really that national umbrella organization for the hospital-based violence intervention programs, and actually the program out of Oakland called Youth Alive has been our technical assistance provider here in the district, and so we have not only sent our HVIP teams to Oakland, but they've had staff who've come to the district to help us with our programs and build those and build shared goals and objectives across all the HVIPs and policies and procedures, which is something that we continue to enhance. The Alliance for Safety and Justice, I know, is an organization that is doing some really, I think, critical work around criminal justice reform and ensuring that victims' voices are part of that conversation. And I think really illuminating that is not a monolithic voice, and that there are many victims and survivors of all types of crime who are strong supporters of criminal justice reform and looking at alternative outcomes than solely those that are offered by our criminal justice system. Because for many victims and survivors, they do not feel like they actually achieve a sense of justice through our historical criminal justice system. So yes, I'm very familiar with their work.
Ms. Garcia, I'm Robert Bennett. That was a wonderful presentation. And as you may know, excuse me, this commission has to make recommendations. And I'd just be interested to know what recommendations you would like to see us make that would be of assistance to you in your work.
So I don't know that I can speak to specific recommendations that I would offer, because I think, like I was just saying, there's not a monolithic voice with which victim survivors speak with and which they would identify their needs. But I will say this, and I'll go back to what I was saying earlier, that anything that we can do to further enhance the work that we're doing to effectively recognize and respond to trauma, I am a cheerleader for. There's probably no one in the district who spent more than 5 minutes with me who has not heard me talk about trauma. I'm a depressing person at parties because that's the thing I like to talk about. But I think it is where we have the greatest promise to have the greatest impact on people's lives and on communities, and not just so that people are surviving, but so that they're thriving. So that is what I would say. Any ways in which we can continue to enhance the work we're doing on trauma is something that I'm strongly in supportive of. And I'm going to hopefully not cause vertigo for anybody, but swing you all a little bit so I can plug my computer back in.
No
my
problem.
apologies.
Thank you, Director Garcia. So we're going to take one more question. I believe Blaine, you had a question, and then we'll move forward in our agenda. But we're deeply appreciative for your insights and expertise today. And I think that there are some things that we'd love to, as a committee, follow up with you on, and the other committee that's on youth and policing as well, since we started on truancy. But Blaine, I think you had our closing.
Yeah, I
question.
just had a quick question. Thank you, Director Garcia, for the presentation and for presenting to the committee. We really appreciate it. I was curious though, because the only thing I'm aware of in terms of like batterer intervention programs is through CSOSA's domestic violence intervention program. Are there any other programs of that nature operating in the district, or is that one of the only pathways that people who commit acts of domestic violence could actually get that kind of treatment?
So my understanding, there had been another program running out of CFSA. It was a voluntary program that was provided in a partnership between CFSA and one of the district's domestic violence providers called My Sister's Place. My understanding is that it's actually no longer being offered. I only just recently found this out, so I don't have much more information as to whether that's COVID related or something else. So it may be again that it is CSOSA. The one thing I will say about batterers intervention programs, and there is a robust body of literature around batterers intervention programs and their efficacy. And I think it can be succinctly summarized as it works for some batterers some of the time.
Yeah, definitely. And that's something I'm definitely cognizant of. I was just curious because I know some places try to do a little bit of both, but I know the batterer intervention programs haven't been stuff that's been picked up a lot, and the evidence is kind of, some of it's there, but not really. But thank you. Appreciate it.
Absolutely.
And again, thank you so much, Director Garcia, for joining us. And I will put in okay, Samantha, one more question. Let's make it a question, and then we can make sure we get to some of the business items before we close out.
All right, yes, definitely a question. Wanted to know if you have any thoughts or information in terms of custody orders between families that I believe sometimes occur, the exchange sometimes occur at school sites. And so curious to know if any of your families that you work with have had experience with those exchanges, and in what way your work supports that exchange or law enforcement is involved in that exchange.
So that is actually not something that I believe any of our providers participate in. So I really don't have anything I can offer on that. I do know that there's a federal funding available for both what's called safe visitation and safe exchange sites that communities can tap into. I thought that the courts in the district at one point had funding for that, but I'm not certain if that's still the case or not. But to my knowledge, none of our providers participate in that. And so I know safe exchange is a critical concern for safety. As someone, again, who did stalking work for 10 years, the risks for the victim parent in those situations is extremely high. And it's a great question. And unfortunately, I have very little information to offer on it.
I appreciate what you did offer. Thank you.
Well, thank you everyone for your questions. Again, to Director Garcia, I think that especially some of the questions about truancy or pointing things like that point to is that there's a lot of overlap, I think, between the different committees who are doing this work across the commission as we address some of these issues. So I know that Commissioner Davis and I helped to co-lead the committee focus on youth. And so you could probably expect some outreach specifically around some of those questions that particularly focus on students and schools and young people. But
if I just one plug for the youth committee, I mentioned that when I started that we coordinate the district's juvenile justice advisory group. The JJAG in February released a report with recommendations around removing status offenders from the juvenile justice system. And I think there's a lot of great information in that report. And I believe, Ms. Hill, that you already have it, but I just wanted to put that out there for everybody else.
We were just, yes, we were actually just discussing. So when I said follow-up, I really meant it. We were actually just discussing the PENS report specifically and the JJAG and following up on some of the truancy reduction program work to bring that to the youth committee. I think it's good. It's fantastic timing.
Absolutely. Happy to help in any way, provide any additional information we can.
Thank you so much. So we do have a few business items that we need to attend to in talking about some of our upcoming meetings. So I will hand it off to Jennifer from Impact Justice to just guide us through that, and then we'll transition into the end of the meeting. But thank you everyone for your
And I will just say good night. Thank you all so much. And I will, Jennifer, send you a copy of my PowerPoint to distribute. Will that work?
Yes,
okay, great. Thank you. And it has my contact information on there as well if anyone wants to reach out with follow-up questions.
Great.
Have a good evening, everyone. Thank you for all your work.
Bye. So just quickly, the upcoming, I did not realize when I started reaching out to Deputy Mayor Mitchell, the Deputy Mayor for Public Safety, that the commission's meeting in December would be on December 14th, the second Monday instead of the third Monday. So I'm working with his scheduler and special assistant to reschedule that meeting. I am hoping that you all can do it. He's available on the 21st, which is the following Monday. And he will not be available again until middle of January. So do I have your permission to schedule it for the 21st? Anybody opposed? Anybody not available? Okay, I will go ahead and do that. Thank you. I wanted to just draw attention to, and I really want to hand it off to, I think that Samantha or Lashunda to talk about, speaking of overlap between committees, there is a meeting of the Schools and Youth Committee next week that should be of strong interest to you all as well. I believe, if I'm correct about this, there's going to be a panel of people talking about the use of violence interrupters in schools. Do you guys want to, either of you want to say a couple of things about that?
I was actually going to say Ron can say something about it because he's moderating.
Perfect. Oh, did he? Did we?
Yeah, yeah, I'm here. Let me say this. That we had young people. We've had the other violence interrupters and whatnot, and they were talking about it at one of the past meetings, and then I suggested that violence interrupters and that whole program is not new, along with a whole lot of other things that's not new. And this was back in the 80s, that roving leaders who work for the Department of Recreation, credible messengers, they didn't call it that then, nor did they call it violence interrupters. It was the Alliance of Concerned Men. It was Ron Moulton and I forget what they were called. It'll come to me. And then also
it was called Peaceaholics.
Peaceaholics. And then Al Malik Farrakhan's organization, Ceasefire, Don't Smoke the Brothers and Sisters. They were involved in a project where they worked in the schools, they worked in the housing developments, they worked in the community. They actually had residents in the public housing community, in the public housing developments in this city, where they worked with the families, they worked with the students, they worked with the children, they worked in the schools, they did all of this. And then all of a sudden they stopped doing it because there was some situation that happened. So as we were talking about it, that particular meeting, some of my fellow commissioners were talking about it as if this was the first time and had never ever been done before. And they were very successful at doing what it is that they were doing at that time. So I suggested those individuals are still around. They haven't gotten too old or died off. They are still here in the city, very much active in the community. Some of them are credible messengers and some of them are violence interrupters. They just continued the work that they've been doing all their life. And I talked with some of the Roving Leaders program, And so some of the roving leaders are still working in the schools today as doing coaching and other things. They're not doing intervention prevention work, but they're working with the youth. So on the 16th, working with Impact Justice, we'll have a panel discussion and we'll get a chance to hear them talk about their contribution, the success of it, the kind of things that they were doing, as well as is it something that we can continue to do. And so again, I just thought it was important that we hear and have an opportunity to hear from these guys about what it was that they were doing and the success they were having with it.
Thank you very much. There's also the following day, there's another event that I just wanted to draw your attention to. I know some of this stuff goes out in emails, but since we're all together, I thought it might be helpful to have just a reminder. Blaine, do you want to briefly talk about the roundtable in case people want to attend part of it, or if they want to be involved in any briefing of the city council regarding that?
Yeah, so I think folks are already mostly aware that the Committee on Judiciary and Public Safety is going to be holding a roundtable on the 17th. I think that's what you're referring to, Jennifer, right?
Yes.
That is going to be about exploring non-law enforcement alternatives to meeting community needs. The public comment portion will run from, I think, 10 a.m. to 1 p.m. And then the government witness portion will run from 1 p.m. to 3 p.m. I'll send around the notice for folks who are interested. If you want to be involved in any of that on a personal level, that's fine, obviously. I think we had talked about having one of the co-chairs just give them an update on what the commission's been talking about. So that way they're aware that we're looking at this and they don't sort of jump too far ahead. But yeah, I can definitely send that around and keep you all updated when we get like links and stuff like that so you can watch it. It'll be on cable and Zoom, I believe. So there'll be opportunities for folks to see it. But that's on December 17th from 10 a.m. to 3 p.m.
And the last item is really just if Bethany wants to say anything more about the drafting committee, since we're all together as this committee.
Sure. I think for those of you who wonder what the drafting committee is, we are bringing together a chair from each of the committees to join Christy and Bob on a weekly basis to kind of talk through recommendations that are coming up in each of the committees. The goal is to make sure that people across committees have a good idea of what's going on in the other committees, to avoid overlap, to avoid double work, to kind of see how the recommendations are coming together and kind of moving in the same direction. I'm going to, I think Lashunda is who's going to be representing the VR committee on the drafting committee. So I'm going to be sending an email, if not tonight, tomorrow morning, to try to get that scheduled. So that's something that we hope to start convening as soon as this week if possible, but if not, beginning next week.
Thank you. That's my list. I don't know if you have, if any of you all have other items. Samantha, yeah.
I could just quickly add to the list of events and meetings happening next week. We are the school policing and youth policing committee has been pushing out on December 17th at 5:30 p.m. I believe. I just dropped the link. Every Student Every Day Coalition, which is like Children's Law Center, ACLU, Black Swan Academy, Georgetown Juvenile Justice Center, and a number of other folk are having a town hall on reimagining school safety without police. They'll go and they'll take a deep dive into the recommendations around both the divestment as well as the investment piece. And so encourage all commissioners to attend to find out about the recommendations and then to hear all of the testimonies from various stakeholders.
Thank you, Samantha. As we're at time, but are there any other questions or things from commissioners that we have discussed or haven't discussed before we adjourn?
Yeah, just quickly, when is the panel with the Pizzaholic and the former, the panel that Ron spoke to? When is that scheduled for? Which meeting? Is it next week or next year?
No,
It's on the 6th.
It's the 16th. Yeah, it's next week, right? Next Wednesday.
Okay, thank you.
Yeah.
All right. And we look forward to that panel. So there are, a few items of follow-up after this meeting with Director Garcia that we'll guard forward. But thank you all so much for your time this evening and for a really great meeting. I think we learned a lot. And so I look forward to seeing all of you next week.
Thank you.
Thank you, everyone.
Have the rest of your week.
Good night. Good night.
Right.